fellow countrymen and women, these are our ministers and permanent secretaries at the front bench, representing the various ministries and answering the questions that matter to us. Join the conversation. This is the front bench.
Well, this is the front bench, ladies and gentlemen. Thank you so much for keeping it UBC TV, delivering on the health manifesto. We are looking at what needs to be delivered, what has so far been delivered, and what should Ugandans expect, talking about upgrading hospitals, talking about improving emergency response, talking about boosting maternal care, and very many other aspects concerning our health system in Uganda. And I do have senior officials from the Ministry of Health headed by Dr. Chris Bariomonsi. Doctor, thank you so much for sparing time and for honoring our invitation. Before we dive into the health manifesto and what Ugandans should expect, what is the current state of Ebola in Uganda? Because I think 5 days ago you led a team from Ministry of Health. You went to the DRC to discuss with those neighbors of ours to see how best we can fight this Ebola. But what is the current situation so far in Uganda and maybe from our neighbors as well?
Okay, thank you very much, Jethro, and good evening, viewers. And thank you for inviting us as the Ministry of Health. Ebola. Last time we were here, we gave an update, and we'd like to report again to Ugandans as follows. Like we've been communicating, the current outbreak in the Ituri province. So most of the cases that we got in Uganda were imported cases. Actually, the index case, the first case that we registered here in Uganda was the Congolese who came into the country seeking health care, and then other Congolese came, and then some health workers got infected, and we registered 20 confirmed cases, those who tested positive for Ebola. Of those, 15 were Congolese. Congolese nationals who live in Congo, not resident here. 4 were health workers who contracted Ebola during the process of giving care, and 1 was a driver who drove one of the Congolese. Of the 20, 2 died, 2 Congolese nationals died, and that leaves you with 18. 17 recovered and were discharged from hospital. We currently have 1 patient remaining, because for us to declare you cured or free of Ebola, we have to test you at least twice, and if you test negative, then we discharge you. So there is 1 patient just remaining. I think tomorrow we should be doing a test and see whether has tested negative, and then we shall make a decision on whether to discharge that patient. So of the 20 who tested positive, only 1 is remaining under admission. In the process of managing Ebola, we usually work backwards. When somebody tests positive, we work backwards to trace the contacts, people who have been in contact with that person in the past 21 days. We got to over 800 contacts who were kept under close watch in isolation, and I can say all of them have completed the mandatory period of 21 days and are no longer for follow-up. So all those cases of contacts were followed up and discharged, if I can say that. So in a nutshell, I can say the outbreak in Uganda has been contained. There is no active transmission of the disease in Uganda. The challenge remains on the other side in DRC, where the outbreak seems to be outpacing the response. We still see many cases. I don't have the count for today, but there are over 1,700 cases that have tested positive. That have crossed 500 deaths.
600 now.
How many?
Yep, over 600
Over
now.
600, the PS is saying over 600 deaths. But we are working together with the people and government of Congo. Like you said a few days ago, a team of Ministry of Health, including my two colleagues here and the other officials, we flew to Bunia and met with the leadership of Congo to discuss. Earlier on, our two presidents had spoken and agreed with the regional collaboration, on that bilateral collaboration. Their speaking resulted into a memorandum of understanding, which we signed. I signed on behalf of the government of Uganda, and my counterpart, the Minister of Public Health in DRC, signed. And the MOU defines the collaboration that we are having to jointly address this challenge of Ebola. And that's why you saw us fly to Bunia to have discussions. We have sent our technical teams, our experts. They are in DRC. Part of the arrangement is to open Ebola treatment centers or units in DRC, because I can say the reason why the Congolese were coming here were to seek health care in Uganda. And therefore we agreed that we establish Ebola treatment units. And so far we have established one in Aru. Aru is opposite West Nile, across West Nile in Congo. And then also opened one in Kasaigi. Kasaigi is across in Toroko, across Lake Albert. And we may open more depending on how the situation progresses. And our teams are there working with the Congolese officials to see that we can arrest this outbreak of Ebola.
Honorable, on the countries that still believe that Uganda is not yet stable as far as Ebola is concerned, because I'm aware there are those countries that still block Ugandans from traveling abroad in their countries because of these cases.
Yes, that challenge which has affected our tourism, our economy, the travelers coming here. First of all, we are engaging the international community, especially those countries, to understand that those restrictions, those travel bans were not necessary. Because at first the challenge was the international media and international agencies like WHO, CDC, the way they were reporting, they were lumping DRC and Uganda together. They would report that the cases in Uganda and DRC are 600 or 800. So to an observer out of the world, they would think the situation obtaining in Uganda is the same as in Congo. But we have since clarified, and I think they have changed the reporting style to distinguish Uganda from Congo. But also we are engaged UAE, those countries which had put a travel ban, and I'm sure as we share with them the dynamics here and what is going on, they are reviewing those travel restrictions.
Okay.
And maybe for information and maybe for the benefit of the viewers, we shall wait for that last case to be discharged. Once we discharge that case, then we shall start the countdown before we can declare Uganda Ebola free. And we require to count 21 days plus 21 days. If we don't register in any new case, then Uganda will be declared Ebola free. So as we make progress, I'm sure the other countries, as we engage them, they should be able to review those travel restrictions.
Well,
but our border with the DRC remains closed.
Okay.
For the human populations which move across, but we allow business cargo get through, the armed forces, humanitarian workers, those can cross, but the crossing of Congolese into Uganda and Ugandans into Congo. And I hope the populations along the border understand that it's for purposes of preventing this Ebola. So please be tolerant, understand, because when we were in Congo, the major question they were asking us, the Congolese, when are you opening the border? When are you opening the border? is for purposes of managing this outbreak. And therefore, we request the communities around there to remain patient as we manage this Ebola disease, which is a dangerous disease. And we continue to caution Ugandans out there that even when we have contained this outbreak of Ebola, let's remain cautious. Let's continue following the basic SOPs, avoiding greeting by shaking hands, because Ebola is transmitted through contact with the body fluids which are affected. So sanitize, wash hands, and all of these basic public health measures as we have been articulating them. Let's continue following them until that time when we are very sure that the risk has been eliminated.
Okay, thank you, Honorable Minister. PS, let's talk about delivering of the health manifesto. You have visited, the time you've spent while serving in the ministry, you've visited a number of hospitals, you've been to different parts of the country to ensure that whatever is drafted is implemented to the grassroots. What are your findings as far as delivering the health manifesto is concerned?
Yeah, as our vision, first of all, as a sector, our main objective is to ensure that the population is healthy, and because it's healthy, we want to see it contributing to the national development, and therefore we want to see productivity. And so all our activities in the past 5 years and also in the next 5 years is aiming at ensuring that we have a healthy population. And so the question, for even when we go to the field, we have been putting emphasis on health promotion and disease prevention. That's why when we talk about disease prevention, we talk about immunization. We have increased our antigen, or the immunizable diseases, from the traditional 6 to 14 now. And Uganda is doing well. I must say that the coverage of about 90%, with the exception of a few antigens like measles and rubella, which is around between 75 and 80 in most of the districts. It's not only the immunization, but also we are educating people. We are continuing to sensitize the public to be responsible for their health in disease prevention. We have scaled up the community interventions, and that's why now we are deploying and training the community extension workers in the communities at parish level, so that these particular cadres will go to households, educate, test, because we equip them with a blood pressure machine, glucometer, the tape measure for children to measure their nutrition status, and other services we've been training them, so that really we are able to deal with disease, early detection, sensitization at household, so that we reduce the burden of disease. But having said that, we have seen a lot of improvement in access to care. When we talk about maternal mortality, you know, in the last survey, our maternal mortality has significantly reduced. Actually, institutional maternal mortality now stands at 61%. I mean 61 out of 100,000 deliveries. That is really a significant reduction. Under 5 mortality has significantly reduced, but of course we still have quite a number. We still have a burden of sickle cell that is contributing to 20% of under 5 deaths. So we see also infant mortality. The reduction is significant, but infant and also neonatal mortality has reduced, but not to the level that we want. Our mothers now are more than 80% of our mothers now are delivering in public facilities, which was really not the case many years ago, over 5 years ago. Why? Because the services are accessible, the services are of quality, and we have built trust among the public that they are able to go and deliver in our facilities. Having said that, this is also has been enabled. Why our mothers are going to deliver in our facilities is because the manifesto was very clear in the last 5 years that we make sure that we increase access to health center 3s in the sub-counties that didn't have, either through upgrade of health center 2s or constructing purely new facilities. We have actually functionalized health center 4s, over 30 health center 4s that were not functional. They are now functional. That means that now the referral pathway is perfected, and therefore that's why it's also contributing to less mortality of mothers, but also increasing access. So we see the infrastructure upgrades in the last 5 years, but also what we are planning to do in the next 5 years is we are going to continue to make sure that all sub-counties that don't have health center 3s, all constituencies should have health center 4s. And our health center 4s now, we want to expand them in a manner that they are community hospitals. So they will be like general hospitals. So that's why we want to do a lot of expansion so that they are able to provide all the services. So in terms of infrastructure, we have done a lot. We not only at primary health care, but also even specialized. If you look at a lot of works that are going on for the Heart Institute, for expansion of the institute in Naguru. If you look at what is being done in Cancer Institute, a lot of work is going on, equipment, modern equipment, that really in the future we don't expect people, unless they choose, but they shouldn't be going abroad for treatment for cancers. We are seeing a lot of progress in Rubowa and many more. The regional pediatric hospital in Entebbe, that is now a referral for East, Central and Southern Africa. We are getting many children from Southern Africa and East and Central Africa. So we think that we are getting there, but still a lot needs to be done. Thank you.
Director, the PS has clearly stated the different upgrades of hospitals that are being done, that are yet to be done, the boosting of the maternal care. It seems we are doing well in that sector, but you are running a docket where Ugandans can easily see and notice what is being done. Now, talking about delivering this health manifesto, are we really building that resilient and inclusive health system within our country?
Okay, thank you, and good evening, viewers. That's quite interesting questions. I think what the minister first spoke on the aspect of public health is really because our response has been because of the strengths and the resilience which were built over time. Because this is not the first outbreak which we have had. And actually controlling the outbreak is that in one way actually are able to make sure that the other services continue, because normal outbreaks disrupt what? The outbreaks disrupt services. So we do not want to lose those gains. So that's why we make sure that we control these outbreaks. We want the children to continue immunization, the mothers deliver in the health facilities, and for the other people to seek care. We don't want to see a situation where you have more deaths from other conditions than even you have had from the outbreak. So that's one aspect. The PS also spoke about the upgrade of the health facilities. This has been one of the strategic investment country has had. Because if you looked at that, of the health center freeze, over 50% of the deliveries, 50% of deliveries actually occur in the health center what? Freeze. Even if you look at immunization. So most of the services, because these are the facilities which are nearest to the what? Nearest the people. They don't need to incur additional costs, indirect costs of transportation and others which is do what? Which are able to. So we are looking at over time that in terms of infrastructure, we now need to consolidate. And that's why we have expanded the human resource structures, because now structures alone will not be able to work. We reviewed our health infrastructure. Initially, Health Center 3 was only for up to about 18, 19 staff, but we have expanded it now to 52. The community hospital was about up to 40, 48, 49, but now we have expanded to 152 staff. So if you looked at like now the regional hospital, initially the human resources for health were only around 350. It expanded almost to over 1,000. So the structures in the regional referral hospitals has expanded almost to what Mulago Hospital used to be some few years ago. So these are like, you are moving now mini Mulagos to most of the regions. And the same thing with the general what? General hospitals. Human resources. But I need to emphasize that our key strengths definitely will be on prevention. We really do not want more people to be what? We do not celebrate that people coming to health facilities. We want to celebrate people coming to staying healthy. We still, as a country, have got a double burden of disease, both communicable and non-communicable. And as if you use the proxy of life expectancy, now Ugandans are living up to 68.4 years. But what you need still to know that anybody dying before 70 years is called premature what? Death. So we need to be able to look at how do we get Ugandans live longer than what? The current situation. So that's why we say that we need to add, and most of the, over 70–80% of the premature deaths are caused by non-communicable what? Diseases. And the majority of them are preventable. Of what you eat, exercise, avoid smoking, minimum intake of alcohol, going for screening early. So when you do those are now where we want to change the attitude of people, where we need that your health is wealth, and you need to co-create it. You need to protect it the same way you protect other assets. I know people always understand money more, but you need to understand your health more, because if you understand health, then you can probably be able to make what? Make money.
Director, looking at the demand, do we have whatever it takes? You did talk about upgrading the hospitals that we do have, from Health Center 3s to Health Center 4s, like the PS was explaining. Do we have what we need in these upgrades that we are making?
Now what we need is that, because of geographical, address some of those issues based on population, but also based on distance. And that's why PS spoke of that. We have 488 sub-counties, which the manifesto from 2026 to 2031 is looking to see that how do you address what? How do you address that? So we are looking at that if we are able to address that, then we almost have 100% coverage.
Okay, ladies and gentlemen, we are going for a short commercial break. When we do return, Honorable Minister did visit Mbara Regional Referral Hospital. A lot of things were seen, a lot of things were identified. We shall dive into some of those things, not strictly about that hospital, but we shall generalize, because what happens in maybe that hospital also happens in another hospital. How best can we prevent all those? Don't go away after the break.
This is the Front Bench.
And that's it for today. Till the next episode.
Like a daily bando, like a daily bando, like a daily bando. Omuliro nguwulira muli mu mutima kukankana like drums. Kalakata, kalakata, enendongo yakusabula. Mikono tu, free on fire, free on fire, free on fire.
In a nation hungry for truth, a world where every story matters, there exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world, holding the mirror of our history. With 4 TV stations and 11 radio channels spanning 27 languages, they stand as guardians of information, defenders of truth. With Mascari Heritage Advantage, they uphold every citizen's right to reliable and free information. Their archived stories shaped our past and illuminate our present. Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, and every voice matters. UBC, inspiring Uganda.
They share an office. Some work in the day, some at night. What they have in common: focus, dedication. That's what makes them champions. They also share something else: the reward of being one. The official beer of the FIFA World Cup 2026. Not for persons under the age of 18. Drink responsibly.
In a fast-moving world, why are we still stuck with paperwork? Signing here, stamping there, moving from office to office. It's exhausting. Now, there's a better way. With UGPass, you can securely prove your identity, sign documents, and access government services anytime, anywhere. No delays, no stress. Everything is instant, safe, secure, and government-backed. UGPass, your identity secured. Available on the Apple App Store and Google Play Store. UGPass is a product of NITA Uganda.
Fellow countrymen and women, these are our ministers and permanent secretaries at the front bench, representing the various ministries and answering the questions that matter to us. Join the conversation. This is the front bench.
On the health manifesto is still our topic tonight. As we went in for that break, the Director General was explaining about the different upgrades that we are doing and how best they can fill up the different gaps within the given sectors within the health system and how best they can make them better. Honorable Minister, we did see you visit Mbarara Regional Referral Hospital, to be specific, and in there we still saw patients, of course, receiving treatment, but in a condition that is not really favorable, in a manner that something needs to be done as a government to ensure that patients really are treated to that level, given their expectation. How best can we polish what you discovered to ensure that we have a better way of doing things within our hospitals? Because rumors have it that we still have nurses, maybe doctors, who still solicit for money from patients for them to receive treatment.
Yeah, thank you very much. Before I specifically respond on Mbarara, let me say our mandate as the Ministry of Health is to keep you healthy, you Ugandans who are watching us. But to keep you healthy will require us to work hard, but also you to be part of that process. Like the Permanent Secretary said, we are focusing on disease prevention and health promotion. We can give you the information, but the behavior change has to be on you. If we are saying exercise, if you are saying watch what you eat in terms of nutrition and diet, if we are saying if you are sick, seek health care are enough. Now that's the responsibility of you on the other end. So we have to do this together. If we are going to have healthy lives as Ugandans, because most of the diseases that our health workers are handling are preventable, can be prevented. And we are going in this term to put a lot of emphasis on that, the prevention and the health promotion. Now, coming to my visit to Mbarara Regional Referral Hospital, I did an impromptu visit to the hospital, and that was on Saturday night. And I was there from 10 p.m. to 2:30 a.m. for 4.5 hours. And I had reached there and announced to check what happens in the hospital setting. Well, there are good things, but let me focus on the challenging areas. One of the challenging areas was that there are few health workers. Later, when I engaged the management of the hospital, they tell me their staffing level is at 26%. It means if we expected them to have 100 health workers, they only have 26. So that partly explains why you will not find health workers at work, although in my observation, again also the 26% could be deployed better in the hospital, and we are going to take action on some of those. The other challenge, which I promised to institute an investigation on, is that almost every patient I talked to was saying they are buying drugs. You could hardly get a patient who said, I have been given drugs from the hospital. And when I inquired, I think through national medical stores, drugs had been delivered on the 15th of June, the last consignment, and this was the 11th of July, so like 3 weeks before 1 month had ended. So the patients are saying we are not getting the drugs. So, and yet we have been increasing the budget for medicines. So I promise I'm going to investigate and find out, is it the patients being very many that they consume all the drugs within 2 weeks, 3 weeks before the next consignment? Because national medical stores delivers, I think, once in 2 months the drugs. And the other issue that was also very obvious was that there were many patients, the congestion, filling all the beds and many others being on the floor. Now that one, part of the reason is that the referral system seems to be functional. Because I could get patients from Ruchiga district, from Rukunjiri. There was even a patient from Ntoroko, which is the other part. They even bypass Fort Portal Hospital and they come to Mbarara, patients from Riantonde. So meaning Mbarara Regional Referral Hospital is not only serving Ankole, but is serving a region beyond what we ordinarily thought would be the catchment area. They are getting patients from Chigezi, from parts of Buganda, and so forth. And all those, I think, are very instructive to us who manage the Ministry of Health, that we have to look at the question of space and infrastructure and so forth and so forth. So yes, our health workers are doing their best in the circumstances to provide health care, but there are challenges in the health facilities which we must address, like the issue of staffing. I think it's one of the outstanding challenges in the health sector, and we have to deliberately invest in that, ensure that health workers, especially doctors, are training in these clinical areas, specializing in surgery, obstetrics, pediatrics, and so forth, and we deploy them in these hospitals. But also within government, we are examining at the policy level this issue of dual employment. And the doctors, I hope you are watching, we are looking at it. If we employ you as a consultant in Murago Hospital, given that the government recently enhanced the pay may not be the best, but it's an improvement from what has been obtaining. Should we now ask you to choose between working for government and or going into private practice? Or should we negotiate and say, of your time, you can give us 60% in government, then the 40% in private, but we pay you for 60%. There are all these discussions, because it is also true that many doctors spend more time in private practice and they cheat the government. So we are discussing all those. So yes, there are challenges in our facilities, but the reason why we exist and leadership is to see how to resolve those challenges, and we are up to the task. Of course, knowing that the way our service delivery is arranged, we have those facilities which are under the central government, like the national referral hospitals like Murago, Kawempe, Chirudu, Naguru, Mutabika, then the regional referral hospitals like Mbarara we're talking about. Then we also have decentralized health services, where the district health officer and the district officials are directly responsible for the day-to-day supervision of those facilities, but again they fall under the health sector as such. So going forward, there are reforms we are looking at within the health sector with a view of strengthening delivery of health care as we engage government also to increase the resource allocation. And as we mobilize more resources, our intention is to make sure that we improve service delivery in our hospitals and health facilities.
Thank you, Honorable. PS, as the accounting officer, the technical person in that sector, health is one of the sectors that is given, I won't say enough money, but it's given quite a fair budget to ensure that you run the day-to-day activities within our country. The Honorable Minister did give an example of Mbara, for example. If workers need to be 100, out of 100, they are 26%. He did also mention of those who bypass from Ntoroko, bypass maybe Fort Portal to Mbarara. We must appreciate what is being done. But the question is, why do people bypass even other regional referrals? Someone moves there from Mukono Regional Referral Hospital, maybe to Mulago, maybe because of the kind of treatment they are supposed to get. How best can we streamline this, the human resource? Because the challenges Ugandans are always talking about is medicine, nurses or doctors soliciting money from them, and the human resource. Those are strictly the three basic requirements or issues that Ugandans usually talk about.
No, I think the people choose the hospitals There are for so many other reasons. There are some that choose hospitals because they know somebody there, or their relatives are working there, or someone has referred them there. We have a very clear referral pathway, right from Health Center 2 to Health Center 3, and we have different services offered at different levels up to the National Referral Hospital. But some people, even now, if you go to Mulago, we still have challenges. Some people, you know, someone will have flu and just want to go to Mulago to be treated, even malaria. But we are still working on we continue to educate the people to know that referral pathway, that you don't have to go to the bigger hospital if you have a milder disease that can be treated in the lower facilities. But you can't stop people still from, you know, bypassing some other facilities. I have flu, I'm in Kamuli, but instead of going to Kamuli Hospital, I bypass Ginger and I come to Mulago, maybe because my doctor is there. But that process of really educating people is ongoing. But also, we do believe that we haven't provided all the services that we need. For example, the regional referral hospital, national referral hospital, at that level they are providing specialized services. But you find in some of the regional referral hospitals, because of understaffing, which my minister has talked about, you find people prefer to come to look for a senior consultant in Mulago. Yet those services are supposed to be at a regional referral hospital. But you find that even when you go to our regional referral hospitals, the numbers that are crowding, what you saw in Mbarara and what you found there, is not only in Mbarara, it is in all our hospitals. There are two aspects that we need to look at. The first one is that we are seeing more people coming to public facilities. We are seeing many, many more. Actually, if you were to talk to private hospitals now, their numbers have significantly dwindled. So they are coming. What does that mean? It means that even if there is that crowding you see and people are struggling all to come and get treated there, they are appreciating the services there. There is something that draws. Otherwise, if people are not coming and getting treated and getting better, they will not show up in those hospitals. That means that people are trusting our services more and more and more. But of course that poses the challenge, because if you get more numbers swarm the hospital, they will swarm the few numbers of our facility, of our human resource. They will also overwhelm the infrastructure. That's why some people even have to go down on the floor. They will finish the medicines in time. The medicines that were budgeted for 2 months, they will be consumed in less than a month. So all those things, once we streamline and continue to educate the public on 3 things. The first one, disease prevention. We don't want to see overflow of diseases that can be prevented. So we want to see primary health care services in terms of prevention of diseases really, really affected at primary health care level. At community, at lower facilities, we immunize, we make sure that our children don't come with pneumonia, we immunize. Malaria is reduced, complications that require children to come for admission are reduced. Hypertension that leads to so many complications of heart disease, kidney disease is reduced. Diabetes that causes so many complications that lead people to come and stay in the hospitals for so long is reduced at primary health care. If we do that, we reduce on the congestion. We reduce on the workload on our health workers. Even if we increase, and I know that we are going to continue lobby and get more resources to recruit more, But if we don't address the disease burden, and we still it will overwhelm our system. Number 3, we make sure that we strengthen tertiary services. Tertiary services at regional referral and national referral hospitals. And we introduce those specialized services, like in these specialized entities like Cancer Institute, Heart Institute, so that then we don't again lose more money as a country for people going abroad. So by doing that, we are actually building our economy. By doing that, we are growing our economy. We want to get to tenfold. Ministry of Health is contributing to tenfold growth. And we are committed, and we're really committed to seeing that our specialized services are fully functional. I believe if our Heart Institute is done, and the infrastructure is done, and they recruit, they get resources to recruit, we will not have any reason for anyone flying out of the country to go for heart surgery, unless they just choose, because there are some people who think that it's just a status symbol to go abroad and get treated. Even Cancer Institute, if we really finish the investment plan that we have for Cancer Institute, then we don't really anticipate that many people will be flying to, for example, Nairobi, Aga Khan for PET scan, for what. All those things are going to end, and we are working on this to make sure that. So by doing that, then we are contributing to the growth. When we increase the growth, if we increase the economy capacity, then government will be putting more money. Of 6.4% of the national budget that is going to the health care, which is still very, very low compared to what we signed up for in Abuja Declaration. We wanted 15%, but we've not yet reached there. So how do we get there? We want to get there by reducing disease burden, by making sure that we provide the whole continuum of care at tertiary, primary, and the population, as my honorable minister said, to own their health, so that they stop these things of government to yambe, you neglect yourself, you get diarrhea because you are dirty, your sanitation issues around your home, and you get malaria, government to yambe tewali dagala, but you are not sleeping in a mosquito net. Government has given you mosquito net to sleep in, and you don't want to sleep in it. You take it to catch mukene, you know, or a naka. So all those things.
Or you refuse to take your child for immunization.
Yes, or you don't take your child for immunization, and the child gets complication. Now we are immunizing against hepatitis B. We are immunizing against HPV. We want to see in the next 20 years, we no longer have cervical cancer among young women. So how do we do that? People must also take responsibility over their health.
PS, budget, when the budget is released, or according to how you lay out your concerning health is a priority. But do we have priorities? Absolutely.
We have priorities. If you look at our MPS, Ministerial Policy Statement, every year, if you look at our National Strategic Plan for 5 years, if you look at National Development Plan for the next 5 years, NDP4, our priorities are very clearly outlined in those documents. Even when we implement, when we put, for example, the biggest chunk of our money now is going to human resources.
Okay.
Although, ironically, we are still at 20-something% recruitment. So we do believe actually that if we increase the recruitment, we are going to see, I think, by half of our money in the budget will go to paying salaries. Infrastructure development, supplies. Supplies, we are talking about vaccines and medicines. Every year, government has been increasing the medicines budget by 100 billion. Right now, we are at 741 billion for medicines alone. So all those are our priorities. But as government is committing to investing more, increasing infrastructure, we want discipline. We want discipline of the public. We want discipline of our house workforce, so that we are able to grow. By doing all these things, by the way, our aim is to make sure that we prosper. We want a prosperous Uganda.
Director, the rate at which delivered to Ugandans, money is allocated, hospitals are being upgraded from one level to another. Ugandans are receiving the different services that they're supposed to receive, probably. But the speed at which things are being done, the fact that we are saving lives, how best can we quicken the process? Ugandans are waiting for results.
Okay, thank you for that. We have made very great strides. And you need to be able to look at what are the indicators, because if you look at those indicators which we measure, which the PS has indicated, mortality has come. Institutional mortality, maternal mortality now is almost coming below 60, which is 60 mothers dying out of 100 deliveries. We know 100,000 deliveries. So we know, like if you look at the children, we know that most of them, what's causing them to die is aspect of birth, asphyxia. So we're now looking at how do we improve the quality to be able to address that. When we're looking at now that we have rolled newborn screening for sickle cell, we are aware that sickle cell causes 16% of the under 5 mortality. So we are looking at it. If we invest in that areas and are able to identify and screen early, but also at the same time close the tap that no more are produced, then we are able to do what? To reduce the mortality in that aspect. So we know where the areas where the pressure points where we need to be able to do it. Initially, we knew that most of the mothers were dying because of hemorrhage, bleeding during childbirth. Government has invested. Now we have 3 new blood banks in Hoima, Arua, and Soroti, and one is starting in Busoga region, and in the manifesto we are putting another one in Masaka and in Kabale. So we are looking at we are looking at what are those things which are causing poor outcomes. So that's where the government is looking at investing. And on aspect of NCDs, we have now already the North Cancer Center, which is based in Gulu. But we are looking at how do we put others in Mbale, in Mbarara, in Arua, and Mbale. So we are looking at how do we do that. But as PS has said that, as we do those investments, we need to be able to see that how do we invest in reducing that, because we know that 30% of the cancers are preventable. 30% of them can be cured if you come much more early. And then the other 30%, 40%, we can do palliative, manage the symptoms.
What is the most teaching situation that you're working on as a ministry, for example, to ensure that we calm the situation?
Okay, probably I need also to go to the other side.
Please.
That our population definitely grows at about 3.2%.
Okay.
And that's why we, as Minister of Health, we're looking at how do you get in a manageable population. Because if you have a population growing faster than you are investing, then it means that you do it will overstretch the health systems. So that's why we're looking at how do we invest so that you do not have unwanted pregnancies. Currently we are having 4 out of 10 as unwanted pregnancies, and a majority of them definitely lead to unsafe abortions, and some of them lead to maternal deliveries. So we need to be able to address how do we manage population, because population control or population management is not just it's not about health. It's actually it's an investment in the demographic dividends. You need to be looking at those aspects. So you need to be able that you manage upstream. But also there is a study, probably I need to share this also, that a study which looked at maternal, the improvement of maternal mortality over 23 years. And we found that improvement in childbirth contributed to about 68%. And family planning contributed to the other 38% in reduction. So you need to look at definitely that the evidence should be able to inform our policies or what we do.
Director, issues concerning mental health, how are you addressing some of these issues? Because the youths, I believe, that is a category that is mostly affected. How are you ensuring that you also bring them together to ensure that you fight this?
So mental health, we've in the package of our self-care, that's as part of health promotion and disease prevention. We are coming in what we look at what we call self-care. Is where we are empowering individuals to take care of themselves, their families, and the communities in the presence or absence of what? Of a doctor or a health worker. And so we are looking at that how can we be able to address mental health in that approach, because we are looking at what are the things which are causing young people, because if you visited Butabika Hospital, you find that the majority of them are issues of either drugs or issues of what? Alcohol. So you need to be able to address some of those key things through a policy, definitely. How do you able to control so that you reduce, how do they access these drugs, first of all? Because sometimes you have read those stories where some people have been able to put them either in cakes or whatever. So we need to be able to see how do we address the controls and how do we identify. So all in nutshell, we have a whole of government and a whole of community and a whole of society approach to addressing mental health. So it's just not only the Minister of Health.
Well, let me get to the PS, but later on I'll get to the Honourable Minister to give us a summary of everything as we summarize. PS, the issue of intern doctors. We have those, I'll not call them young people because they are mature people, but they're doing quite tremendous work within the given hospitals where they are deployed. And I do understand they're deployed by government, in the government facilities. What is their fate? We do hear a number of rumors here and there, but we have you, the authority now. Maybe you would help us clear the air. What should they expect? What is on ground?
It is true that the policy was but however there are those areas in the policy that we are looking at and to go back and engage, and my minister maybe will talk about it at length, because we still believe that there is room to address some of their concerns, and we have not stopped. We are still engaging, and we are going to go back to the executive and present those areas we believe that are bottlenecks to implement the policy. So we cannot say that we have stopped. We are fully aware, and so we'll be able to communicate. But in the meantime, we think that in order not to lose the time, because they are supposed to be deployed in August, we could deploy the interns, but at the same time we continue pursue the discussion and the engagement. That's what I can say. But to mention something about what are the most pressing, we think malaria is one of the most pressing condition in the country, because it contributes to mortality. All our mortality in our country, it is number one. and it is the leading cause of highest number of admissions. It is the leading cause of the highest number of attendance to outpatient outpatient attendances. So malaria has been with us. So there is a way it became normalized, but recently, as you've heard, we have lost young people from schools because their immunity, maybe these are people who have not been exposed to malaria maybe for a long time, so they've never even gotten malaria. For example, in Kampala here, the prevalence is very low. So if the people who have been in the area of low prevalence, they don't have immunity, and so if they get infection, it can be really, really, really nasty. Our intervention is really to look at vector control. We want to target the mosquito, want to target the larvae, and we want to scale up indoor residue spraying. We've been giving mosquito nets. Even right now, we are in the process of giving mosquito nets. We are starting soon in Buganda region to distribute mosquito nets, but it's not sufficient. It has not significantly reduced malaria. Yes, it reduces, but then it rebounds, especially when we get those seasons of rainy seasons where we have a lot of flooding. We get rebound and we get really epidemics, and it is contributing to the biggest, our budget, our consumption on malaria drugs and testing and workers, work hours lost. Malaria contributes largest. So in the next 5 years, really our target is to reduce significantly malaria. We want to be bold, we want to be firm, and we are going to speak about this, and we really want to see how we can get everybody interested, from the private sector to government to partners, support our interventions, because indoor residue spraying, recently what we did in West Nile, the prevalence dropped from 20 something, it was even above 20% to about, it was below 10. So we believe that these interventions work, but we need to scale them up so that we significantly reduce malaria. Thank you. Thank you, PS.
Director General, your parting shots, and then the Minister will close thereafter. Your parting shots, the next 5 years, where we have come from and where we are going, what should Ugandans expect, and how best are you willing to ensure that what is in the manifesto reflects what is on the ground?
I think my parting shot is really that as Ugandans, we need to embrace wellness. We need to be able to do and we need to be able to give ourselves as a birthday gift for you to go and do what? A wellness check. So every other time, that's what you need to be able to do. Because if you do that, as it is always talked of, prevention is better than what? Sure. So and if you do that, the other aspect, the second aspect which I want is that we want that no child should not have zero-dose children. In October, we are rolling a national immunization against measles, rubella. We really want that. Let's have all the children, because we've had outbreaks of measles in Uganda covering almost most of the district of the country. So prevention, wellness check, and the other aspect is that as responsible citizens, we should be able to take responsibility. Ride the border, or if you are driving, drive carefully, and do all those things which you think that are within your control, which should be able to keep you safe and keep others safe.
Thank you. Honorable Minister, the issue of intern doctors, corruption, accountability. Ugandans are expecting a lot from you.
Yes.
As we wind up.
One of the observations I made as I visited Mbarara, and this was true for the other hospitals, that there is over-commercialization of medical care, both even the formal commercialization with a clear exemption criteria for the indigent, the poor. When I was in Mbarara, the patients told me in this ward, in the medical ward, it was in the female medical ward, I think there are many patients, when they prescribe for them drugs, they say, you have to go and buy these drugs, you need a CT scan, you have to go and pay. Many of them will just pack up their bags and leave. So we shall have to review it. And when I engaged the director about the exemption criteria, if somebody comes and is extremely poor, the exemption criteria was not very clear. So meaning that the poor, when they come, they fail to afford and go back. It's an area which we shall have to address. If I am poor and I can't raise the money, and I have come to a government hospital, why shouldn't the government give me the treatment? This is a question we shall discuss with my colleagues in the ministry, but it applies in Mbarara, but Murago, Cancer Institute, and many other places. Because as an MP, I also feel it when people come to us to support them, and they go for these medical services, and then they call back, oh, they have asked me 600,000 for this, 400,000 for this. So it's an issue we are going to address our minds to, and see how we can make the services affordable. Yes, if I go to the hospital as a minister, I can probably afford and pay. But there is that grandmother of mine in the village who may not be able to afford, and yet the government should be able to provide decent and quality care to this. Then those who are the health workers and hospital workers who are charging under the table money without a receipt, I am just giving, I hope some of the health workers are watching this show, that you have to stop. You have to stop. We may not tell you the measures we are going to institute. I hate actually seeing a health worker being handcuffed. It will be the last thing I should see. But I would want to caution the health workers that those who have been charging money illegally should stop forthwith. I was told by a woman in Mbarara that they asked for a disease has something to do with the chest, and I was asked to go for an X-ray, and they asked me to raise 250,000 shillings, and this woman was very poor, and he said, so for 6 days I have been here, the X-ray has not been taken. Now I ask the director, he says, no, X-ray examination here is free. So now I was saying, whose word should I take? Then in the ward they also told me to wheel a patient from one place to another, you pay some money. So there are those under the table payments some of our bad health workers are charging, and would want to throw a caution to them that you should stop. All of us here have practiced medicine, have worked on patients. What used to motivate me as a health worker was not the salary, was not the money that I earned, but a patient coming in a very sorry state, very sick, and you use your clinical skills and knowledge and you restore the health of a patient. That's what used to motivate us. But now things seem to have changed, and we have to fix all this. Now, number two, the interns, like the PS has indicated, there is a policy which was passed, the health training policy from Ministry of Education, which looked at internship and characterized internship as part of training. And then a decision was taken that since it is part of training, if you have been government sponsored, then the government shall continue sponsoring you during internship. That if you have been privately sponsored, then you continue being privately sponsored in internship. But I think there are questions around that from the public, from all those concerned, and we are listening government. So we have listened to the concerns. We are going to prepare a cabinet paper, and I will take it to cabinet to examine that policy. But the deployment of interns shall continue as earlier programmed, but we are looking at that. So the interns, the doctors there, I will use the words of Jesus, that let your hearts not be troubled. So we are examining all this, because truth be told, when I went to Mbarara, The only doctors I found on the ground were intern doctors. I found 4 in emergency surgery, 2 emergency medical side, and 1 in the labor ward, which I also quarreled about with the director, because they have 40 medical interns in Marago, but only 5 were working in the hospital. So even the few health workers there, the deployment, but those are administrative issues which we shall fix with the hospital. So the interns, that question of payment or remuneration of interns, we are readdressing it, and we shall sort it either way, so they should not be worried. Now my final comment is that, one, like we've discussed, we are going to mount a huge campaign on disease prevention and health promotion, because when you go to a hospital or a health facility and you find it congested, you'll find a number of diseases which are afflicting the people could be prevented if something is done, so that you minimize and reduce these numbers. So we're going to put a huge campaign, and we want to ask you, the media, to give us platforms where we can educate the public, the do's, the don'ts, the basics, and so forth. But that will not mean we shall undermine the clinical and curative services in our health facilities. So there are many things we have lined up, or which we are doing, like ensuring that we have healthcare workers of different cadreship, consultants, mid-level cadres, the nurses, and other allied health professionals to be deployed in our health facilities, but also address issues of infrastructure. Actually, we want to reverse the trend of medical tourism, that instead of Ugandans going to India, going to Nairobi, South Africa, we would rather work on our facilities, and then the people seeking specialized care should be able to come to Uganda. And we are already starting, we are putting a state-of-the-art facility for the Uganda Heart Institute here in Naguru. We are turning the Cancer Institute into a center of excellence. We have now organized the organ transplant facilities in Marago. There are many. You should give us more time because we are reorganizing the sector. So you asked, what should Ugandans expect in the next 5 years?
In a minute, Honorable.
In the next 5 years, we are going to work 24/7, during the day and during the night, so that we improve the quality of health care in this country. That commitment, that resolve we have as Minister of Health.
Thank you so much, Honorable Minister, Dr. Chris Bariomunsi. Thank you so much, PS, Dr. Diana Twine. Thank you so much, Director General, Health Services, Professor Charles Olaro. Ladies and gentlemen, thank you so much for being part of the show. Issues concerning health, issues about health, I believe it starts with you as an individual. The senior officials have talked about it. Just like security. Security starts with you. Do not expect a minister or a PS to come to your home to teach you how to do certain things, but through the media, through the space that we do give them, you've learned a lot from them. But hopefully we shall have them back to dissect other issues concerning affordability. What is that affordable thing that we always talk about? Do we manufacture some of these things in Uganda? Talking about medicine. If we are manufacturing our own medicine, then why can't Ugandans have it? If we are manufacturing different vaccines, why don't Ugandans have it? That is what we shall return with next time, hopefully, God willing. From me and the entire team, I am Jethro Kasaigi. Good night.
Oh, Uganda, may God uphold thee. We lay our future in thy hand. United, free for liberty, together we'll always stand. Oh, Uganda,
And that's it for today. Till the next episode.
Like a daily bando, like a daily bando, like a daily bando. Omuliro nguwulira muli mumutima kukankana like drums. Kalakata, kalakata, enendongo ya kusabula. Mikono free of fire, free of fire, free of fire.
UBC, inspiring Uganda.
Good evening once again. Welcome to the second edition of News Tonight. It's me, Michael Jordan Lukumwa. Let's start with a look at the top stories. President Museveni holds talks with the RDC Special Envoy on Eastern DRC and regional stability. The Electoral Commission starts national verification of voter registers for LC1 and Women Council elections. Civil society organizations on HIV respond rubbish recent remarks by former Human Rights Commission chairperson, while Sacred Heart SS Gulu launches Northern Uganda's NADO Cup.